How do you know if your knee injury is serious? And if it is, what should you do next? I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best, regardless of age or injury. Knee injuries are extremely common, probably the most common injury seen by sports medicine orthopedic surgeons. Most of the time, they can be treated at home or with a doctor's care. If you have any of the symptoms we're going to talk about, I would argue it's important to see a doctor or orthopedic specialist. All right, first, locking or catching. This means you're unable to straighten your knee or you have difficulty in that your knee gets stuck in certain positions. This inability to straighten your knee can be a significant sign of a serious knee injury. If you can't straighten your knee, especially all the way, it could mean a ligament injury. One or more of your ligaments in that knee have been torn. It could indicate a certain type of meniscus tear that keeps your knee from bending or straightening. It could be caused by loose pieces of bone or cartilage floating around in the knee. This inability to bend or straighten your knee most commonly is caused by a meniscus tear. The meniscus is a C-shaped piece of cartilage that cushions your knee and can tear as the result of either specific trauma or overuse or arthritis. Another worrisome symptom would be buckling or giving way of the knee. Your knee buckles or has this feeling like it's going to collapse, maybe when you try to stand or try to walk or try to run. If your knee buckles or gives way unexpectedly, that's a sign, very likely sign, something is just not right. You may feel like you're losing control of your knee. It could buckle at any time. Again, walking, standing, and the one that I'd really watch for, when you plant your foot to change directions and then your knee gives way, that would be a worrisome sign. You're probably going to feel a lot of pain when that happens. You may actually feel an audible pop or hear an audible pop, feeling a pop or snap inside of your knee. You may have significant swelling in your knee. If any of that is present, it could indicate a torn ligament like an ACL tear. Another one, significant swelling of the knee. Swelling of the knee is really common with a lot of different injuries. And I don't mean just a little amount of swelling, but a significant amount of swelling. This could be caused by a fracture, a broken bone in your knee. It could be caused by a torn ligament. Sometimes you'll see it with meniscus tears or arthritis, but usually with those, the swelling isn't very bad. If you have a lot of swelling in your knee, it's important to see a doctor to determine if there's a serious injury present. So if you're having any of those symptoms, it's important to see a doctor, and sometimes sooner rather than later. They can examine you, look at x-rays, maybe even get an MRI if it's your primary care doctor. They may recommend seeing an orthopedic surgeon to get the best treatment for that injury. I'd love to hear about your knee injury and your experience with it. Leave those in the comments below. Just understand, if you ask a question, I can't offer you medical advice, but what I try to do is I try to answer your questions in future videos. Also, make sure to subscribe to my video channel and click the bell to be notified when I release a new video and when I start my next live stream, including my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.